There is a lot of chatter around intermittent fasting these days. Is it true that this popular trend can lead to heart attacks? While the concern is valid, but when done correctly, intermittent fasting can be powerful ally for your heart. So think of it this way: when we fast, we give our bodies a chance to clear out blockages, detoxify, and improve overall cardiovascular health. Hi, I'm Dr. Vikas Sangotra, an Ayurvedic practitioner with 15 years of experience. You're watching eBlosis, and without wasting any time, let's dive into how intermittent fasting can impact cardiovascular health, especially from an Ayurvedic perspective. So when we talk about cardiovascular diseases, they have become a leading cause of mortality worldwide, often stemming from the blockage of blood supply due to obstruction in the arteries. In Ayurveda, the heart is seen as a key player in the circulation of rasa dhatu as well as rakta dhatu. Dhatu is a tissue, rasa is a nutrient-rich fluid, and rakta is a blood. So rasa, that heart helps in flow all across the body, that nourishes the body's tissue. And notably, Charaka and the Shishruta, the revered Ayurvedic master, emphasize the heart as a central organ in the circulatory system, describing it as a primary point where ahara rasa, the essence dried from digested food, enters circulation to nourish all the dhatus. Understanding the connection between cardiovascular system and the rasa dhatu is very important, because your heart is the root and the branches is the vessels through which the blood and the nutrient plasma is going all across in the body. Cardiovascular issue through an Ayurvedic lens reveals several key factors that contribute to heart health problems. Heart health is closely tied to the state of rasa dhatu, that is nutrient fluid, which I just talked about. So whenever there is an imbalance in a rasa dhatu, it can lead to blockages in the heart and the blood vessels it has. Excess kapha dosha, because the rasa dhatu and the kapha dosha has guest and the host relationship. We'll be talking about this in a different video. But as of now, when there is the excess of a kapha dosha which is characterized by its qualities such as heaviness, slowness, and stability. So when kapha is excessive, it causes that stickiness, blockages, and obstruction in the circulatory system. So this excess or surplus kapha creates that thick, stagnant blood, impairing circulation, increasing the risk of heart disease. Even when we talk about excess of kapha, the accumulation of ama is another key factor in the blockages of the vessels in the heart. Ama is a toxic byproduct that results from incomplete digestion. So when there is a digestive fire, that is your agni, which is maybe erratic, which is maybe weak, that is manda, all this leads to accumulation of ama in the body. So this accumulation can circulate through the body, lead to the blockages in the various health issues in the various part of the body, and specifically also affecting your heart. So combination of ama, that toxic waste, and the kapha alleviate the risk of cardiovascular problems. What is the impact of a rasa dhatu imbalance? An imbalance in a rasa dhatu influenced by excess kapha and ama affects the nourishment of the heart and surrounding tissue. This disruption hinders the smooth flow of nutrients, resulting in harmful substance accumulation, which increases the likelihood of cardiovascular blockages. By addressing these factors, Ayurveda provides insight into preventing cardiovascular issues and promoting overall heart health. And this is where intermittent fasting comes into picture. Intermittent fasting as a therapeutic approach. If we try to understand how intermittent fasting can help in therapeutic approach, then this is really a beneficial practice for reducing risk of cardiovascular diseases by addressing the root cause of Kapha imbalance and ama accumulation. So we need to understand how the reduction of Kapha happens. When we understand intermittent fasting, which promotes burning the stored fat, helping to reduce excess Kapha. So this reduction clears the blockages in the arteries, leading to improved blood flow and overall heart health. So by engaging your body in fasting periods, we encourage the mobilization of a fat and detoxification of stagnant fluids. Also, we talk about intermittent fasting. It also works at another root cause of the problem, which is ama dosha. How does it do it? The fasting allows the digestive system to rest and repair, so which enhances your agni. When your agni is enhanced, it promotes the elimination of ama from your body. And when we talk about the body, this process is very crucial in maintaining clear channels for the circulation of rasa dhatu, which eventually helps preventing blockages that could lead to cardiovascular problems. When we have the intermittent fasting, which is working at the root cause of blockages in the heart because of imbalanced kapha dosha, it is working at the ama, which is a further culprit in the blockages leading to cardiovascular risk. Another important aspect which is very helpful, and this is achieved with the help of intermittent fasting, is the metabolism. So intermittent fasting improves the body's metabolic function, enhancing the ability to break down and utilize nutrient efficiently. So a well-functioning metabolism reduces the risk of fat accumulation in the arteries, ultimately lowering cardiovascular risk. Also, when I talk about the benefits related with the regulation of a blood, the sugar and the insulin level, intermittent fasting help regulate blood sugar and insulin sensitivities. So these are two crucial factors for maintaining heart health. High insulin level can lead to fat accumulation and inflammation, both of which increases cardiovascular risk. So intermittent fasting really work at how insulin levels are there in your body. Intermittent fasting also work in enhanced circulation. So by promoting a healthier lifestyle through intermittent fasting, individuals can experience improved circulation and reduce stress on the cardiovascular system. Regular fasting can help lower even your blood pressure and improve heart function over the time, which we have already discussed in different videos about the general benefits of intermittent fasting and the specific benefit of intermittent fasting. The link is given in the description below. What is the bottom line? Incorporating intermittent fasting with balanced diet, regular exercise, and attention to Ayurvedic principle can pave the way for a healthier cardiovascular system, so which allows for smooth circulation of rasa dhatu and the nourishment of all your body tissue and the balance of your ama dosha, excess kapha, and that's the way it can give us healthy heart as well as body. But always consult with healthcare professionals or an Ayurvedic practitioner before making significant changes to your diet or lifestyle, especially if you have an existing health concern. I hope today's video answered your question. So if you have any other doubts or queries, please write down in the comment section. Don't forget to like, share, and subscribe. I will see you in the next video. Lots of love to all the beautiful souls out there. Namaste.